What is the role of an anesthetist in craniosynostosis surgery? Now let me tell you a very interesting fact. 30 to 40 years back, craniosynostosis surgery was regarded as a very dangerous surgery with high mortality rates. But now things have become so smooth and we have evolved so much that in our practice in the past 10 years, we have never ever had a mortality. Now why this has happened? This has happened mainly because of the evolution in the techniques in anesthesia and the increase in the role of the anesthetist in craniosynostosis surgery. Now, as we all know, in craniosynostosis surgery, there is a lot of blood loss. We get very young children with fragile bodies and also physiological conditions which are not very conducive for major surgery. So, our surgeon and the anesthetist are working in together so that the surgery becomes absolutely safe. Now our anesthetist, mainly our pediatric anesthetist and neuro anesthetist, work to keep the blood pressure of the baby at a very controllable level so that blood loss is low. They do all sorts of things to decrease the blood loss, like giving some injections like tranexamic acid to stop the blood loss, doing blood transfusions, doing a very smooth induction of anesthesia and maintenance of anesthesia, and a very early recovery of children after anesthesia. We see this especially because previously children used to be intubated or a tube used to be there in their mouth after the surgery overnight. But now things have evolved so much that we immediately extubate the children, that we take out the breathing tube immediately, and children can resume almost near normal activities like feeding and walking around, running around within 3 to 4 hours of surgery. So the role of an anesthetist is extremely important in craniosynostosis surgery.